Right, good afternoon all and welcome to today's meeting of the Adults and Communities Overview and Scrutiny Committee. For anyone listening at home, I'm sorry we're a couple of minutes late, we just had some minor IT issues. As usual, this meeting is being broadcast live to the public. For those not able to watch live, the webcast will be recorded and made available for viewing on the County Council's website after the meeting. Before we begin, can I please remind everyone to only turn on their microphones when you wish to speak or are invited to speak and to switch it off once you have finished. I would like to inform you that Dr. Kevin Feltham, who is our newest member on the committee, has passed on his apologies for today's meeting, but we welcome him on board. Kevin is replacing Barry Champion, who I think has been a real asset to this committee in his time on it. He has been very involved, very articulate, and looking after the best interests of the council and his residents. So we wish Barry well in his new role on the council. We're not losing Barry, he's just gone on to different things, and thank Kevin for taking his place on this committee, although we recognise that because of the changes he hasn't been able to adjust his diary for today, and unfortunately we've not been able to find a substitute for him. So item number 1 on the agenda, minutes of the meeting held on the 2nd of September 2024. I propose that the minutes are taken as read, confirmed and signed. Is that agreed? Thank you all. We now move on to agenda item 2, question time. There are no questions received from members of the public. Agenda item 3 is questions asked by members under Standing Order 7.3 and 7.5. I've received no questions from members. Agenda item 4 to advise of any other items which the chairman has decided to take as urgent elsewhere on the agenda. No urgent items are being taken. Agenda item 5, which is declarations of interest in respect of items on this agenda. I believe that all councillors here present are also district councillors. Please shout if that's not the case. And therefore, as usual, that will be recorded in the minutes. The reason we're particularly pointing out today is that we will go into confidential session. This really is for members of the public for the last item, and it's just right that the public know that we are both members of the county and district councils at that time, but with everything we do at county, we act solely as county councillors, and I wish to stress that for the interests of the county council. Has anyone got any other declarations they wish to make? Thank you all. Now moving on to agenda item 6, which is declarations of the party whip. Do members have any declarations from their party whips? Such declarations have come. Agenda item 7, presentation of petitions under Standing Order 35. No petitions have been received. So we're now moving on to agenda item 8, which is the first substantive report today, which is the draft Adults and Communities Department Strategy 2025 to 29, as set out in pages 13 to 64. This will be presented by the Director, John Wilson, Inderjit, the Assistant Director, Stephen Shippey, Improvement Manager. Now, as I said to John before the meeting, if you can take the view that councillors have fully read all the papers, so all we're asking people to do is just to spend a couple of minutes on highlighting any salient points that you wish to do so, rather than going through the whole of the report. So I'll start with you, please, John. I'll start with Inderjit, sorry.
Over to me. Thank you, Chair, and good afternoon, everyone. So presenting today the new strategy for adults and communities, which is part of the pack sent out. In the paper, it details kind of our journey. So we've currently got a strategy which is 2020 to 2024, and the new strategy is aimed at a 2025 to 2029 timescale. The strategy focuses on the whole department, so it's adult social care, our communities and wellbeing services, and our adult learning services. And it details the aspects around our future direction, and that's threaded across the whole strategy. The strategy builds on our current one, in terms of the whole prevent, reduce, delay, meet the needs ethos. Provides key areas around how we're going to achieve some of those key areas. There's been extensive work with the public through a range of engagement sessions to help to shape the strategy. Stephen's done a lot of work across a range of community organisations and their own engagement panel. I'm going to ask Stephen just to go through some of the key points around the document. So they're in the appendices attached, and Scrutiny has to comment on the strategy and the direction before it goes to Cabinet for formal approval in December to consult, and then we'll undertake a consultation exercise, I think in February, for 8 weeks. And then Stephen.
Good afternoon, ladies and gentlemen. So part of creating the draft strategy, as Indy said, I've met with various service users, people who draw on the services from the Adults and Communities Department, gathered some information around what they felt the current strategy was missing and what they'd like to see in the new strategy. From that, created the draft version, and we've created some new additions to the new draft compared to the previous strategy, which included departmental team descriptions. There's quite a lot of services that fall within adults and communities, and the public weren't necessarily aware of what those services were. We've included within it a strength-based approach in promoting independence, although that was a theme of the previous strategy. We've highlighted that as a core section. We've updated information around our strategic model, which we are going to continue with, so the Wellbeing, Prevent, Reduce, Delay, Meet model. We've added in some additional detail to allow the public to have a firm understanding of what that represents. And we've included a people section and a communication and engagement section, and that really came from the engagement that we did. We really wanted our providers to understand that we are committed to supporting their workforce as well when they're delivering their care services, and also our internal staffing, that we're committed to supporting those as well. And we've tried to link in with all of the current different strategies in place, so the people strategy and obviously the strategic plan. The updates of our aims have been considered for each of the sections, so they are now current now for up to 2029. We were coming out of a period for the last strategy which was COVID quite influenced on, and we're moving now into promoting independence. We've recognised that it is going to be quite a tough climate in terms of financial stability, so we have made reference to that also. The ambitions are still threaded through from the previous strategy around improving our customer experience, promoting our well-being, high quality information and advice, developing new investment for social care programs, promoting our independence of the people that we serve, working collaboratively with our partners as well. There's quite key elements throughout the strategy of that. And then building the flexible, talented workforce, a seamless transition from children's into adult services if you require them, and also an improved use of technology if appropriate, as and when required. Thank you.
Thank you very much, Stephen. Just before I go for questions, members will have been provided with a list of comments from Health Watch Leicester and Health Watch Leicestershire, as they were unable to join us today as they normally do. There is a observation on this part of the agenda that you've already had and would have read. So I'll just bring that to your attention. Has anyone got any questions at all? Stunned silence. I'll only speak for myself then. I think one thing I have noted in my time as chairman of this committee is I think the strategies have got more succinct. I think they've got clearer. I think they're easier to read, particularly for not just this committee but for members of the public. So I think as a committee we welcome this strategy. We welcome the fact it's going out to consultation, and I think as was mentioned by yourself, Indy, that it contains that continuity we would expect to see in a strategy of this nature, where it's carrying on from the previous strategy but adding in those new threads and themes and aims. So again, I think we're extremely supportive. I hope I speak on behalf of the committee. We're extremely supportive for this strategy, and again that's consultation, and would like to pass on our thanks to all those who produce it, because I think it's an excellent document, and I must confess personally it was one of the easiest reads I've had in a long time on this committee. So I think a great piece of work for all. So we're asked to note the report and the draft communication and the engagement plan, and therefore recommend to Cabinet goes out to public consultation. Are we all happy with that? Right, thank you all. We're now moving on to agenda item 9, which is the Care Quality Commission assessment of local authorities. which is on pages 65 to 124 of the report. John will introduce this. I assume Santok's not joining us. But we have Christine here, so all is well. So welcome, Christine. You're clearly doing it for two people. John, if you want to kick us off, that would be fine.
Thank you, Chair. So this is sort of usual update. We agreed with the committee that we'd have 6 monthly updates on the position with regard to CQC assessment of local authorities. The most significant update, I suppose, this time around is the fact that we have now received our notification of assessment. So we received a letter on the 9th of September to tell us that CQC would be visiting Leicestershire. So that brings us in with around 50 local authorities that are currently in the process. As it says at paragraph 9, there are around 15 reports that have been published, but there are around 50 authorities that are actually in the process of going through an assessment. We'll come on to some of the timelines around the assessment process itself as we go through the report. So from those that we've seen thus far, paragraphs 10 and 11 give a sort of summary of the themes that are coming out of the published reports and the areas that we are obviously considering in terms of our own assessment. So as paragraph 14 goes through a sort of a process of assessment. So first notification is sent to a local authority that CQC will be carrying out an assessment, and they then ask for a whole set of information, which is called the information return. The information return is then submitted within 3 weeks. Following that process, the CQC will send a second letter informing of the date of the actual on-site assessment, which will be, we think, 6 to 8 weeks following the date of the second letter, which should be within 6 months of receiving the first letter. If you're following me, if you're still with me. So we got our assessment notification on the 9th of September. So we are expecting that we will have a on-site visit somewhere probably around the beginning of March. Just to note at paragraph 15, it notes there that the CQC do take account of any local factors such as elections or any of the major events locally. If that timeline were delayed, and obviously if we're getting into March, we could be in a pre-election period, that wouldn't prevent the CQC from undertaking their assessment. They would still continue the assessment process, but they wouldn't report on it until after any election had taken place. So in terms of Leicestershire, as I said, we got our notification on the 9th of September. We returned our information request by the 27th of September. That was in excess of 300 documents that we submitted to the CQC. We know that the CQC have contacted our local providers of social care services. So they've already undertaken a survey of local providers, asking them about their relationship with the county council and the support that's offered through the council. They will also be contacting local voluntary agencies and other partners. When the site visit is confirmed, we will start to have more detailed and in-depth conversations with those colleagues that we know will be involved in the direct interviews and meetings with the CQC assessing officers. But we do expect that would include, alongside people who draw on care and support and frontline staff, it would include the cabinet member for adult social care. It would include opposition spokespersons, chair of this committee, chair of the health and wellbeing board, along with myself, Chief Exec, and the Director of Public Health. Self-assessment has been updated for submission to CQC, and we've included that at Appendix A. We've also included within today's report a copy of our improvement plan. which is a key document that we've been working with over the last 6 months, and the details of both the self-assessment, or the summary of the self-assessment and the improvement plan are included in today's report. Won't go through those in detail, but just to say that we have, in developing both the self-assessment and the improvement plan, we have obviously engaged with people who draw on care support and frontline staff to seek their views, to make sure that what we're looking at and what we're putting forward to the Care Quality Commission is reflective of the views of the people who use services and for our frontline colleagues. Good Chair.
Thank you, John. Do you have any questions? I think you're stunning everybody in the silence though, John. I would only make the comment from my point of view is having been involved in this since the start, particularly the helping to build some of the appendixes. I think we've done a really good job here as a council. I think this committee has been kept fully involved, which I thank John and the officers. And the reason I like this report so much is it actually, whilst it's most of it we know, it puts it in one place, which will be extremely useful coming up for the future. I'm looking forward to my interview immensely, I'm sure. But again, I'd also like to thank Christine and Ted as our portfolio holder and support for the way we've worked collegiately across this committee to get where we are. I have no doubts that we will perform well, because I think we've got a fundamentally really good adults communities section. So it's nice to see it in one place. So thank you for this. I appreciate it's sad if you don't get a lot of questions from us, but I think that actually is a testament to the quality of the document and the fact that, again, we've been involved in producing it and making it. So thank you very much for that. And we await with interest the date. I'm sure you'll presumably get the notification on Christmas Eve. I would hazard a guess, or perhaps the 31st of December, just as a present for you. I hope they don't send letters, do they really? Do they send an email? Oh, that's all right then. I was hoping, I was thinking that it's back to the health service. I thought they might have sent us a fax otherwise. But so thank you for that. So again, I think we're just being asked to note the report from memory. If I can go back up that high, I think that's what it says. You can never find anything when you're looking, can you? Yep, there we are. Right. The address says. So we're just happy to note the report, and I look forward to it with interest. We're now moving on to agenda item 10. I'm sorry, Christine, you didn't get lots of questions, but thank you for coming. Same with you, Stephen, and you probably think it's a wasted journey, but I think it doesn't hurt to, and if you could pass back to your teams that our thanks for the production of both the last two agenda items. So now moving on to agenda item 10, which is a report on the Adult Social Care Customer Service Centre, which is pages 125 to 136 of the report. And again, let's see who we've got here today. Let's see if I can get this right. This must be Katie, I'm assuming. You see? No, it's right. I'm slightly ahead of the curve for once. I'm not normally this efficient. I think John is going to introduce the report. We've got Katie Murphy here as the change lead. Are Tracy and David not coming, or are they online? Or David's online. Sorry, I've just seen you, David. On our hybrid meeting, we got David Stanton, who's the change manager. And again, I think, as we said to others, we've read the papers in great detail. All we're looking at is any salient points you want to expand on that perhaps you feel we might have missed. So over to you, John.
Thank you, Chair. So it's a report on some work that we've been doing over the course of the last 18 months with colleagues in the transformation unit to improve the customer experience for people who are, particularly those people contacting adult social care services. And going back over that period of time, it was clear that one of the key areas where people who draw on support, people who contact us as a council, one of the key areas that they were showing the most dissatisfaction was in our customer service centre and the response that people were getting when they were calling us. So this was an area that we knew was one of the 2 or 3 big areas that we needed to improve as a department. So we undertook a piece of work, as I said, with transformation unit colleagues, with Katie, with David and others, to look at how we could improve the experience of people who were contacting us. And we thought it was something that we wanted to bring through committee, both for your awareness, but also obviously for you to be able to ask any questions that you might want to in terms of the work. I'll hand over to Katie and David for the detail, if that's okay.
You hear me? Awesome. Yes, so as John says, we've been working alongside the service to look at iterative improvement. So that's been the main focus over the last sort of 12 to 18 months, really. So kind of historically, the Customer Service Centre for Adults sat within corporate resources. And the first piece of change was to basically move that back into the adults department, which gave the department a lot more kind of visibility and control and ownership to make changes that would improve some of the to improve some of the things that John's just mentioned in terms of satisfaction of customers was kind of the primary driver for that. My involvement has come from a place of the customer programme more broadly. So on Wednesday this week, we've actually got an item on the agenda for scrutiny around the customer experience strategy. So recognising through projects like the Adult Social Care Front Door and some of the other areas within the council, I think corporately as an organisation, we've kind of recognised that need to have a stronger focus on customer experience. And actually, if we get it right for the customers, we're noticing that we are almost kind of removing that waste and actually freeing up our capacity to do a better job for the residents that we serve. So that's kind of the context in which we've been sort of working with the service area. I've only just started, Tracy, so I don't know if you'd like to start.
Yeah, thank you. So just, I don't know if Katie's alluded to this, the Adult Social Care CSC is the front door by which people approach the local authority. And what we aim to do is seek as much resolution as we can for people, rather than bringing them into the authority. Contacts are generally through 3 main channels, so telephone, email and online dedicated portal where we support people to self-serve. I don't know if Katie again alluded to this. We had a peer review in March 2022, and prior to that review, we had a service centre that had 2 models. Tier 1, managed by corporate resources, and Tier 2, which is managed by myself in adults and communities. So the improvement plan and project commenced in 2023, and we transferred the resources from corporate resources into adults and communities. So the department now operates Tier 1 and Tier 2. So the key elements relating to the improvement plans are listed below in paragraph 9. But Katie's probably picked up on some of these things around inconsistent call times and answering missed calls from customers, staff recruitment and retention issues leading to vacancies and turnover of staff, and the handoffs and kind of to multiple people within the service centre and then out into the locality teams. So in addition to that work that was commenced in spring 2023, we looked at additional requirements in October of 2023. So we looked at all channels and how people were managing to respect of the demand of calls and how frequently we were getting to those calls, the high level of manual effort related to handling of emails and trying to make those more systematic and respective portals, and the high volumes of contacts across all channels that allocated workers were not being contacted by people. So we put in place some elements to address that. There was a high number of calls that were not for the local authority, and only 13% of incoming calls resulted in information being given as a primary outcome. So Katie and David worked with officers in my service area and outlined the kind of context related to diagnostic service objectives, and then how we looked at continuous improvement. So Katie's right, it does fit with the wider strategy, and you'll see that in the appendix that we've improved a range of the performance measures over a period of time. I don't know if you wanted to pick up anything specifically, Katie, on the diagnostic and service objectives.
So yes, I suppose just in plain English terms, diagnostic, we're just really looking to understand who it is that's making contact with us, what are they calling about, and are we dealing with those contacts in the most effective way? And I think just by improving our understanding of that as a department has really kind of helped us target the improvements that we've been making. And as I've said, it's been an iterative improvement. So we've not kind of gone, actually, we know exactly all the problems, we're going to solve them, within a 6-month period. It has been a bit of a cycle of ongoing learning using the evidence and information that's kind of been coming out through the trials that we've been doing. In summary, contact into the front door is broadly a third professionals, a third families and friends that are making contact on behalf of a service user, and then a third, the rest are service users themselves. So quite often, it's not actually the service user looking to make contact, they are seeking other people to make that contact for them. So quite a lot of the focus and improvements we've been making around efficiencies has been linked to trying to streamline and think differently about how we serve those people that are making contact on behalf of others, so that essentially by doing that, we can free up the front door and the phone calls for those that do need to ring in for us. So kind of looking at the different channels available to us, thinking how do we use email and online portals differently? How do we engage with our stakeholders, so professionals and providers, to interact with us in a way that frees up the advisors to speak to those that really need to? So those sort of improvements has allowed those incoming call demands to come down. And also, as Tracy said, we had quite a large proportion of people that were making contact that didn't need to make contact. So there's been a reduction in the calls and kind of contacts that aren't actually for the council. So when I say not for us, we're talking people that need to actually speak to the district about a housing related matter, or someone that needs to speak to the city council. So trying to get down to a level of true demand for the organisation. So we almost had like an inflated volume of people making contact with us. So that reduction comes from addressing some of those failure demand reasons, really. So it's been quite a iterative process in the changes that we've been making. I think we are on a journey in terms of customer voice and how we use that better to make the changes. So I think in the report we reference an initial informal engagement exercise where we sort of reached out to most recent customers making contact with us to understand what their experience was and how satisfied they have been with our services. And within that, I think about a quarter of the respondents across the council were for adult social care. The response, yes, there is still room for improvement. So we're not saying we are exactly where we want to be, but it has been, I think some of the feedback we've received has actually been a lot more positive from an adult social care perspective compared to other areas in the council. So it's been quite promising to see in terms of what we're doing there. So quite a stark shift in terms of satisfaction at the front door, although there is still some additional work to do. I think one of the big pieces of work that's still we're working through with officers kind of end to end and not just the front door is making sure that those service users that are already being supported by us can make contact with the person that's supporting them in a timely and efficient way, so that we're not so we can be as responsive as possible to those people that are already receiving support. So there's sort of our focus is starting to sort of shift a little bit more to people who are already supported by us and making sure that they are continuing to be able to make contact with the appropriate person at the right time within their overall journey. So there are a few areas still underway in terms of improvement.
So yeah, sorry, just to pick up on that point that Katie made there in respect of if you've got an allocated worker and I'm your allocated worker, we don't want you to have to contact the service centre when you could contact me direct through my direct dial number. So that the aim there was to reduce people being handed off or not getting the right answer at the right time. So that was communicated out to all officers within adults and communities. So hopefully it's fairly new in respect of that kind of improvement, but we're hoping to see more kind of progress in respect of that right time, that right place, that right person.
Thank you very much. First question from Bill.
On page 132, it says consultation till 10th of November. Scrutiny Commission on the 6th of November. Could you clarify that, please?
So that relates to the wider customer programme, and it was consultation that's underway, and you're due to present some of those feedback in respect of the consultation on Wednesday, I believe. Is that right, Katie?
That's correct. So there's been conversations with Scrutiny Commission back in March, so the Corporate Resources Scrutiny Commission around the customer programme, and one of the things that we we received back in terms of feedback was making sure that there was community and member input into the development of that strategy and consultation on that strategy. So the consultation on that customer experience strategy started back in September, and it closes at Sunday midnight this week. So that report is being presented to Scrutiny Commission, Corporate Resources Scrutiny Commission on Wednesday. So that is a strategy for the whole organisation, of which some of the principles within that clearly apply to adult social care customers as well as other customers across the council.
Bill?
Yeah, thank you, Chair. I'm one of those people in the last year and a half who's has contacted social services on behalf of someone else, and sometimes it went really well, and other times it was incredibly frustrating. So I think that's perhaps a fair reflection of what you're reporting in here. And I think one of the concerns I've got is you said you've done a snapshot of evaluation of what the people ringing up, and just thinking about, I'm not trying to use, I'm just going to use my own experience. When you're contacting social services on behalf of someone else, sometimes, quite often, it's in a crisis situation for that person. So therefore, it's a bit unclear sometimes how long it's going to take for things to get resolved. So what I've read the report, and what I'm concerned about, if you're then trying to or if there's a move to put people to use the portal, you fill in a report on a website, and you send it off, it can be a little uncertain and unclear how long it's going to be before there's a kind of response or the reaction to whatever the situation is. So I think it's good work that's happening, and definitely want to get rid of all the calls you don't want, because that's just box up the real calls, and I think we all understand that, and that's really, really important. But what I'm wanting to understand a bit more is how you're going to make sure that what you're doing is continuing to ensure that the end user is having an improved experience, or actually getting a resolution, rather than, yes, they've made contact, but then they're not sure what's happening next. Maybe, I don't know, I'm not saying that's my experience, but I can see that for some people that could be an experience, and I just want to understand that a bit more. Thank you.
So I think one of the things that we as a programme recognise is that kind of time frame for the next steps in respect of people's journey with adult social care. And one of the things that we've looked at is, quite often when you contact other organisations, it will tell you what those next steps are. So if we need to ensure that you're seen by somebody who's in our care pathway, we give you a time frame for that. So we say, thank you for your call. The case will now be transferred to one of my other service areas, for example, Home First. And the time frame for this is generally that somebody from the duty service will contact you again to see how things are progressing, but also may come out during that day when that call's made if you're in crisis, or will agree a rough time frame for allocation of a case to a worker to come out and complete those assessments. So we are trying to look at, are there steps that we can build in that will be able to see people how, and we're not talking about navigation, we're talking about the next steps of your journey and what that time frame will be. So it's something that other organisations manage, and we all know the organisations that we contact, and it says you're next in the queue or your delivery will take place at this point in time. We're looking at whether there are things that we could generate in respect of improvement in relation to those, weren't there, Katie?
That's absolutely right. The customer experience strategy is not meant to be a document that sits on the shelf. I think it's about getting the whole organisation to live and breathe some of the principles within that. And we know that sort of that transparent communications and timely and proactive comms is a trend that we need to crack across the organisation. Clearly from within adult social care, we need to think of it in the context of those customers that we're talking about here. But it is very much on the agenda for looking at the tools that we could use as an organisation to help track that kind of level of transparency, as well as culture and practice within all the teams. And I think this is where we start to talk more about just the front door, but actually it's an end-to-end kind of accountability and responsibility that we need to just join up a bit more. So I think a lot of the work we've done so far has been targeting, freeing up that capacity within the front door to do a better kind of initial conversation. Now we can start to think about how that sort of translates end to end. So definitely more still to be done.
And just in respect of the report as well, we've got a set of principles around I want to get through to the right person at the right time. I know what my next steps in relation to my journey are. But related to the wider programme, it's about ensuring that we target our resources where we best need them and can utilise them. So you'll see in respect of the diagram that we've got targeted face-to-face contact or telephone calls at the top of the element, but we do need to use all of the channels effectively so that we can focus that most demand for like kind of highly complex people at that level.
Joel?
Thank you, Chair. I'm just looking at the chart on page 135. The table, I should say, and I just want to concentrate on the abandonment rate that you've got there. Yes, it's gone down in September, but I think it's quite high. 20% is quite high. 353 people. And then the line below that says on average people are waiting 6 or 7 minutes in September, but on average 19-20 minutes before they speak to an advisor. And I can imagine in all that time, if it was my mum coming on the call, she'd just get frustrated why somebody wasn't answering. So do we offer like callbacks at all on the service to actually, so people can say, actually, I don't have to wait on the line, I can call back, I'll get a call back later on in the day or whenever it is, just to filter out some of this, people waiting on the line and getting frustrated.
Yeah, I know that we do have the functionality within the telephony system to do the callbacks. I think that IT are looking at some of the issues that testing has shown on that. So it is something that's on our pipeline. Just to clarify, in case you've I've misunderstood what you've said. For example, call queue time. So people were, when we originally measured before we started any work, they were waiting 19 minutes. Now the average wait time has reduced to 6 minutes. So people are waiting less time than they were before. I think our target when we set this out, because we obviously kind of baseline was really quite poor, our target was 10 minutes. So we are now below that target of 6 minutes. What I would say is it wouldn't be unrealistic to say we could get that down a bit more. Given, we have some examples like registrar services, I think they're at 2 minutes per wait time. So obviously the less people wait, the better. In an ideal world, we will have a situation where if you're a member of the public making contact with us, we can prioritise those calls and over professionals. And again, we're sort of looking at how technology can help us do that. So at the moment we are splitting out calls. But yeah, how we kind of resource the different nature of the calls is something we are looking at.
Okay, cheers, thank you.
And just on another note, in respect of the duration of calls, if I'm having a conversation with one of the officers and I'm just talking about one individual, that duration of that call might be shorter. But on occasions, there are colleagues and other professionals that ring in and will want to refer multiple people in. So, I'm a district nurse, for example, and I want to refer 5 people in. Obviously, to get all of that information into the right format and then to understand what to do, that's going to take longer than that one call. So some of the figures are kind of not skewed by that, but the duration is dependent on the number and types of people that are coming in.
Okay, thank you.
Thanks. Just a question from me was on the same line, really. I was looking at paragraph 29. About the people that have already got an allocated worker, but they're still ringing in. And it was just that functionality of, can our system recognise somebody who's perhaps called in, has already got an allocated worker, we've gone through all the details with them, they've got that, but then 2 weeks later they phone into the service centre again rather than to the allocated worker, so we can direct them. Because I think technology is wonderful when used in the right way. I mean, don't worry, I tried to ring Hive last week and it says you will be waiting a minimum of 65 minutes to get through. So we're doing all right compared to Hive, which is a great thing. But it's really that functionality and, what is the trade-off in cost of that extra functionality against the benefits it gives us? Because it strikes me as it shouldn't be. I mean, I was being a bit facetious with John this morning. Gave the example. I ring up my local Chinese and they know my name because I phoned them before. So if my local Chinese can do it, we should be able to do it as well. And say, hello, Mrs. Smith. you shouldn't have phoned us, your allocated worker is.
This one, I think we have a customer relationship management system, the CRM, but it is pretty low level. We don't spend a huge amount on it at the moment, and again, it's a slightly bigger customer program task to solve to get that kind of something that the front door can link kind of to left all channels, kind of the omni-channel approach to the ultimate end case management system. So at the moment it is a fragmented system. So we've got the front door using a specific system that has access to the case management system, but the two are not interrelated. So and in relation to kind of being able to do much with our repeat call data, yes, we have repeat call data, but it is it's skewed, shall we say, by the fact that we get a lot of professionals and care providers ringing us and ringing in about multiple individuals. So being able to sort of look at repeat calls in its truest sense is quite difficult in an environment where you've got 60% of people ringing on behalf of somebody. So it's definitely something we haven't solved yet. I think that we can certainly look at whether IT can help us get some better insights into the repeat call demand going into our kind of locality workers, and whether there are any trends in kind of blockages at the individual worker level. But yeah, that needs some looking into. We haven't solved it.
I didn't think it would be solved. I mean, I think we've made great leaps forward in this. I mean, the call times themselves demonstrate that. So we're extremely happy with the journey, and for those of us who've been on the committee for quite a while, this is a significant move forward for which we thank everybody. One final thought from myself is, I know when I was a new county councillor as part of the induction, we got given a tour of the call centre, and I know it's probably 2 call centres. I was just thinking, with an election coming up fairly imminently, I just wonder if perhaps a visit to the call centre should form part of induction for new and existing councillors after the next election, because I personally got a lot of value from going to the call centre and seeing people answer calls, and it does bring home to you the work of a county councillor if you've not been one before. So could I just perhaps suggest that somebody puts a little note to think about that for the induction pack for new councillors after next May. But other than that, we're all happy to note the report and the progress that's been made. Thank you for that. So we're now moving on to...
Sorry, thank you. Ted and Christine, you've actually attended the Customer Service Centre, haven't you? And look at how it operates and get a feel for the types of work that come in, the people that are handling those calls. But by all means, anybody at any point we're more than happy to kind of show what the adults and community side of the service centre does.
I think we recognise that. It's just that new councillors sometimes won't ask, and if it's part of their induction, it might be useful.
Can I just say, of course, that sometimes the people that call our call centre probably haven't got the confidence to go down any other route. And if they've rang their designated worker and the person's not rang up, then they ring somebody else. Hopefully, they can help them, because sometimes with our adult residents that need our support, need it there and then, and they can't understand that we're not available 24/7. So it's not like, ordinary people sometimes ringing us in.
Yeah, thanks, Christine. The other thing that I was going to say is, if I'm the allocated worker for somebody and I'm away from my desk, what I should do is either put my phone calls through to what's called a duty team, or to somebody else within the team. And one of the things that I see from what's called case notifications is, if somebody's tried to contact Katie, Katie's not available, what will happen is I will case notify Katie that Mrs. Smith has tried to contact Katie and requires a follow-up. So it's not, people are not just left, basically.
Did notice that at the call centre, that it comes through and that person says, say I ring and Katie's my worker, and then it's registered that I have rang her. So it's quite interesting when we went along, wasn't it, Ted?
Okay. Well, I mean, when you consider that we were there at least an hour being talked through the computer systems and how each person's got their own caseload of people, it would actually be very informative for for people to go through. And earlier on this year, I actually had to use it for somebody I know that had quite a sort of an emergency situation, and to say that from contacting the call centre to having a member of staff out there looking after this person within 12 hours was hugely impressive.
No, thank you all for that. I think that was the point I was trying to make, albeit badly. I think the service has moved forward immeasurably. And I was just making the point that when I was a new councillor, I benefited enormously from seeing the breadth of calls that had come in. And I think it's a good way of councillors developing empathy with the pressures that staff are under, but also seeing it from the customer side of, you know, how they feel they're being looked after. So it's a great learning curve, I think, for new councillors. And I said the sole course was just to put in the new member induction pack, or in fact, old member induction pack. So I don't think you're ever too old to keep going back. And I said it was great when I visited and got the chance to listen to the call. So thank you. We're now moving on to agenda item 11, which is an update on the adult safeguarding activity report, pages 137 to 144. I think this is with John and Santok, who's leapt up to the desk. And again, as we're kicking through, I think just any salient points you wish to reinforce with us would be grateful. So over to you, Santok.
Of this today. Thank you. Afternoon, everybody. So I will keep to the key points, really just provide you an update and some assurance by the report. I think it's always important just to reassure ourselves of the arrangements that we have in place. And I just want to kind of assure you that we've got the Safeguarding Adults Board, which I think we're all familiar with. Underneath that sits an internal adults safeguarding assurance group that looks at the day-to-day business and the operational elements, which is really fundamental. And supporting that governance group and the whole workforce, so to speak, the organisation, we have various processes and policies in place, ranging from multi-agency policy and procedures right through to making safeguarding personal, practical guidance, and also managing allegations against people in positions of trust. So we've got a robust foray of policies and procedures that help staff deliver the safeguarding duties. And the latest edition is really a growing area of concern across the country, not just in Leicestershire, those people that are experiencing self-neglect, living in squalor, finding it very hard to engage with people or agencies. And we've designed what we call a VARM, a Vulnerable Adults Risk Management Guidance for staff and partner agencies to pull that together for us. That should be launched in the next couple of weeks. So there'll be a robust workshops, training for frontline staff to become familiar with the concept of neglect and vulnerability, and hopefully that will see an improvement in the way we capture and work with those individuals going forward. Just to reassure the board again, our learning and development offer is very good. It's quite robust. We have a format of e-learning modules that start from a very low level in terms of becoming more aware of what safeguarding is, how to raise a concern, right through to safeguarding core training for those staff on a cold face, having to deal with safeguarding inquiries on a day-to-day basis, and then fundamentally looking at organisational safeguarding, adults training. And what we're hoping to do going forward is make it much more role specific as well as we develop. So assurance-wise, we've got good processes, we've got policies, we've got good pathways, and we've got good commitment to training from frontline staff as well. With regards to the performance data, as you can see from the report, we've got a level of alerts. And just to put this into context, a piece of work was done prior to myself arriving in Leicestershire, which is where we really need to clarify the process for what constitutes a really good safeguarding concern, as opposed to general welfare concerns. And by doing that, you can see the difference in the way the performance is starting to shape going forward. So we had in Q1, 521 safeguarding alerts received by this quarter, a very slight increase, but actually appropriate in the sense that we're now really focusing on safeguarding concerns rather than general welfare concerns. So we're hoping to see that improve and maybe increase a little bit further as we get to grips in the whole new process gets embedded. With regards to inquiries, we've seen a bit of a dip in the inquiries, but that's fairly reassuring in the sense that we're dealing with more appropriate concerns coming through. We will see inquiries increase as the new process settles in and people are more familiar. And the reason for that is we're now starting to capture whether or not the alert is a safeguarding concern from day one, rather than wait until we've gathered information. We're actually logging it in the system as a safeguarding inquiry from the very initial contact and the triaging that takes place. So we'll see more and more improvements as we progress. With regards to completed inquiries, it's reassuring that out of 237 safeguarding inquiries started, we have completed 234 in this quarter. And that is a completion rate of just short of 99, if not 99%, depending where you want to put the decimal point. But we're doing really, really well in completing the inquiries within the quarter itself. What isn't helpful, and I suppose reassuring for us, but that's across the country, is the neglect and acts of omission, as you can see on point 10, the bar chart, remain the highest type of characteristic being reported, closely followed by physical and psychological abuse. So neglect seems to be a really core theme across not just Leicestershire, but across the country, seems to be coming out high. In terms of location where the alleged abuse has occurred, again, it's if you look at the bar chart on the top of page 142, person's own home is the highest at 86, closely followed by care homes or care settings at 80. And again, that hasn't changed much, and it's quite stark, really, the number of incidents that actually occurred in those two settings. Just to move it on to making safeguarding personal, we've seen a slight dip in this quarter, which you would expect. It does fluctuate, unfortunately, but we're still in the 90s, so we're doing really, really good. We're not, in a highly concerning state at this point in time. We've hit 93% in this quarter, so we're still doing pretty well there. It'll remain a future focus for us as we try and hit, as it will get as close as possible to 100%. The conversion rate, we've done really, really well. We were at one point in 22-23 only chalking up 10% conversion. We're now 46%, and regionally we're the second best. So again, those changes that we've made to our processes and our pathways is starting to reflect in the way our performance is improving. So I'm really reassured with that, and that will continue, no doubt will continue to improve. And you can see from the conversion rate bar chart that we're just behind Derby City, really, and hopefully this time, in the next 2 quarters, we'll outdo Derby City as well. With regards the safeguarding adults reviews, there have been 3 to date in the last 12 months, or two years, sorry, they've been published, and that those, I think we've submitted the links for those as well for yourselves. Just to reassure you, we take the learning from those and feed that back into training and learning program for our frontline staff, and make sure that we try and avoid any repeat mistakes going forward. So overall, those are the Chair, those are the most pertinent points in the report itself.
Thanks, Santok. Questions, Joel?
Cheers, thank you very much. I just looked at the bar chart, and it's fantastic. We're doing 46% compared to 10% previously. What are you doing differently to have changed it around, as in specific, because it's a big jump, from 10%. You can imagine if you'd gone up to 15 or 20 to 25, but it seems to be a bit of a turnaround.
I think, if you want to.
So largely this is down to the work we did last year around what constitutes an alert. So Santok said, a couple of years ago, we were concerned that we weren't necessarily getting all of the alerts that we should. So we did a lot of work with partner agencies and the public to say, you must report any abuse that you think is taking place, etc. And we went through a process of classing every concern that was coming through the door as a safeguarding alert. And then last year, and we got to a position where we had 10% conversion rate. So what we would effectively have done is, whenever you have these kind of calculations, on the one hand, you've got your denominator, and on the other hand, you've got your numerator. And we were just looking at everything coming through the door and saying, let's class this as a safeguarding alert. But then, of course, what you find is that actually, when you get into it, only a very small proportion, at that point 10%, were actually going on to a safeguarding investigation. So last year, we decided we needed to be much clearer about what was a safeguarding alert and what was just a general concern for welfare. We'll deal with it in another way. We'll put it through our care management process. We'll send it out to locality teams where people are need a bit of support, but we won't class it as a safeguarding alert. And by doing that, we'd taken down the denominator by a considerable margin, because we're not classing so many, and naturally, therefore, your conversion rate goes up. Now, what should the conversion rate be is the question. So, what would we expect to see? All right, sorry. Oh. Right. So, what would we expect to see? I think looking at national averages for conversion rates are in the high 30s, high 30%. We're currently at about 46, as it says here. We were at 10. We were a complete outlier when we were at 10. We're about the second lowest in the country, I think, at one point. We're now at 46. I would hope, and the national trend is upward. So if we stay around that 46% mark, we're probably going to be in about the right place, I would suggest. The other thing, of course, is if you've got so much coming through the door and you're trying to kind of filter everything, you sometimes don't see the wood for the trees. So the fact that we have managed to divert alerts that are not safeguarding activity means that we get a much clearer view of those that are, and we can investigate those much more fully.
Thank you, Chair. I've got two questions, and one of them is quite similar in actual fact to Jules there. Mine was on alerts on page 140 there, was the amount it's increased by. It's alerts, it's section 7, page 140, where it's gone up to 521 from the last quarter being at 457. That's question one. You can come, I can do both at the same time if you're happy with that. And my second question is regarding page 142, the bit you picked up on already, about 80 cases in care homes and 86 in own homes. Do you have a breakdown whether they're between family members or actually care workers in those situations? I answer the second question first. So yes, we do break down the alleged perpetrators, so to speak. And I just happened to quickly have a conversation with our performance colleagues. So for that quarter in particular, we've got 139 completed inquiries, of which we've attributed 62 that fall into the social care staff group as potential alleged perpetrator type. With regards our health colleagues, we've got 16 identified as healthcare professionals and others. And then we've got not known plus others at 41 out of 139. And then the family come in at 20 that fall into that alleged perpetrator type. So again, it kind of, without knowing all the details of each individual case, we do track it, and maybe we can provide a bit more of a detailed breakdown of the next update in terms of alleged perpetrator types. With regards to the increase in the alerts, I always look at this in two ways. That it's a positive that we're getting the alerts, so in a way that's good. People reporting, people that kind of understanding their responsibilities and duties. The increase in itself, I think, is still manageable. I think with the process seems to be reflective in that it's much more clear, it's more easily understood and owned by staff. So I think at the moment the rate has gone up, but not excessively, and I still think it's manageable at this point in time.
Sorry about that, Chair. Well, one of the questions I had has been answered, which what is the conversion rate about? But you've answered that. Thank you, John. So the other question I got, and really, I understand exactly what the report is saying, and basically you're trying to distinguish between welfare and safeguarding, but I can imagine at times that's a thin line, a very thin line, and I'm just wondering, how are you ensuring that you're getting that? I mean, obviously it's quite a lot of it is, some of this is subjective to a degree. So what are we doing to ensure, I suppose it's a quality issue, isn't it? How are we making sure that we're not, shall we say, just putting something down to a welfare issue when actually it really is a safeguarding issue? And so what are we doing about that? And just picking up the point that made about neglect, being one of the very high causes, and particularly in people's home. What further analysis has been done to understand what that neglect is caused by? Is it caused by other people, or is it actually as a result of that person perhaps being medically unwell, ill themselves, and so they haven't actually been able, thinking if someone's got early onset of dementia, they actually don't look after themselves as well. So they can neglect themselves by not eating and drinking properly, or paying bills, or cleaning the house, or all sorts of symptomology that might appear, and someone might think, oh, so I'm just wondering what we're doing to further analyse what these causes of neglect are, or is it just it's other people and therefore that's what it is? Thank you.
It's always difficult with safeguarding, but I've always had a motto, and I know every training that I've been on is, if in doubt, you put the alert in, you make sure it's followed through, and either you'll come out with an inquiry, or you'll actually come out with a more of an informed decision to do a support plan for the individual. And I think that's engrossed in our training as well, that if there are questions of doubt, then actually the best pathway to take is our safeguarding pathway. In terms of understanding the causes, as you can agree, that it's all very, very individual. So what we do have are audit programs to look at themes, to look at causes or issues, and those will be fed into our governance group. In terms of we have a subgroup around performance under the SAB board itself. So we do undertake audits to try and really understand what that cause is. And when you do have SARs that identify certain issues, those are taken away as well into that learning and development program. But there is a robust audit program that we do undertake to look at the various causes or the various characteristics of safeguarding throughout the year.
Thank you.
In the absence of no further questions, I just want to say thank you, John, for your explanation of alerts. In fact, I think it does show, and I'd only point out to public at home that I think it's a great asset of having this committee. I remember looking at this several years ago. We felt we were under-reporting, but the only way forward was to over-report and then put it back to where we need to be. So I think it's a great example of officers in this committee working to try and find, in a difficult situation, what is the right balance of number of alerts that we should see. And I think we did it from the best of intentions to make sure people didn't fall through the cracks and to get to the stage we are now. So I think this is, so if members public often wonder if the county council and officers and members do work diligently together, I think this is a great example of how it's worked. And we've now, I think, probably got the balance right. It will still be refined, it will still be honed, but I think we are in a far better place than we were several years ago because of the joint work that's been done with the scrutiny that we've offered to the officers in a constructive way and the brilliant work they've done coming back. So thank you for that. And I think it's a good mention to the public that we sometimes appear to sit around and chat about things, but they do actually make real differences going forward. I think this is a perfect example. So thank you for that, John. We've now got agenda item 12, which is members are asked to note the date of the next meeting. Don't get excited, you can't go home yet. So the date of the next meeting is scheduled to take place on the 20th of January 2025. And Mr. Bolter informs me that I've got to bring in some stale mince pies at that meeting because we haven't got a December meeting. Agenda item 13, there were no urgent items. Agenda item 14, we do have an agenda item where we have to go into, because the information is sensitive and can't be divulged in the public domain. So I now move that the public be excluded during consideration of the remaining items in accordance with section 100A4 of the Local Government Act 1972, exempt information. I need a proposer for that. Me next, need a seconder. All in favour? Thank you. All right, so we will now go into exempt meeting. If you could please let us know when the live